everybody. Welcome to Cat Talk Radio. This week we have with us again Dr. Brian Hurley, the medical director of AmeriVet Veterinary Partners, and he's here to talk to us about heartworms this week. So welcome to the show, Brian.
Glad to be back.
Yeah, we're glad to have you back. And heartworms in cats is such an interesting topic because it's not something that you think about cats having. I remember hearing it for the first time in a shelter. One of the cats was having difficulty, and one of the vets said, well, cat has heartworms. And I'm like, what? I didn't think cats could get heartworms. So they can. And that leads me to ask, is it something all species can get, even us?
Now, mainly it's going to affect dogs, cats, ferrets, wolves, coyotes, foxes, so and in rare instances, even humans. Though I have not ever heard of that. It was something that came up when I was kind of just refreshing my memory on heartworms and cats.
Yeah, it's not very frequent, is it? Is there a statistic on how often cats get it, how common it is?
I haven't really read a statistic because it is diagnosed rarely in cats, and I think part of that goes with the fact that it's just not on the forefront of our brains because it is rare for cats to get it, that we're looking for it during an exam routinely. So for instance, we test dogs every single year is the recommendation, but we don't do the same thing for cats.
Right.
And, there's also which I'm sure we'll cover, why we don't necessarily routinely run in cats, because it's difficult to diagnose in cats.
Yeah. And now it's the shelter that I first came across this within was in Texas. And we know that, heartworms are really prevalent in the southern warm states. Mm-hmm. And why is that?
Well, because mosquito season really doesn't end. Like it does up in the Northeast, where you get the hard freezes and the mosquitoes kind of go away. Down in the South, it's just a year-round problem, very similar to your fleas and ticks in the South versus the North, because we get that little reprieve. The problem that we see in the Northeast in particular, where I practiced, is the seasons have become so variable. We have the harsh winters, but then we have the real mild winters. And, we see that, hey, when do you stop your heartworm prevention? And people, still are of that mindset in the Northeast that you just stop your heartworm prevention in dogs when winter begins. And that's not necessarily the case. So, and then when it starts back up can be variable because winters can end sooner, sometimes run long, And I think that's partly why we have the recommendation of year-round heartworm prevention in our dogs.
Right. So you were saying that it's not something that you routinely check for. So well, first of all, let's start with what's a heartworm, right? What is a heartworm? It's not a heart-shaped worm, right? So
it's a parasite. So, there's two types of parasites that we look for. So one of the things that everybody thinks of when we say, oh, we want to test for heartworm, they go, okay, do we need to bring a stool sample in? Because they're so used to the roundworms, the hookworms, and some of the other internal parasites that impact our GI system. Where heartworm is a parasite, and it is a long worm, they can be incredibly long, upwards of a foot long, that reside in the heart and lung tissue of our pets, both dogs and cats. Though we also know in cats that it can kind of move to other areas of their body too, because they're not the primary reservoir. They're not the natural host for the heartworm. The dogs are the natural host for the heartworm. Mm-hmm. But it doesn't mean the cats can't harbor the heartworm as well.
Interesting. I'd never heard of it being in lungs or other places in the body.
Yeah. So, if you think about it, all right, so you have the mosquito is going to go bite most likely a dog or coyote or wildlife in the area that has adult heartworms in them. And those adult heartworms breed within the host, and then they create the baby version of the heartworm, the microfilaria. When the mosquito bites the infected dog, let's say, they're going to take that blood meal and they're going to get the microfilaria in their system. And within the mosquito, it's going to go through a little larval change within about 14 days, 10 to 14 days. And then what happens is that mosquito now takes another blood meal from the next dog, or let's say in this case, since we're talking about cats, cat. And then the microfilaria are going to start to migrate through that mosquito bite and get into the system. In our dogs, they end up maturing back to the adult phase, and we don't see that happening as much in our cats, just because, again, of the nature of they're not the natural host. So that's kind of the mechanism of what the heartworm is and how it actually gets transmitted to our canine and feline patients.
Interesting. So what symptoms would a cat be presenting that would make you do a heartworm test? And what are some of the other things you'd probably think of 8 other things before you'd ever think of heartworms in a cat, right?
Right. So anytime a cat is, coughing, they can have asthma-like symptoms that we are worried about. Trouble, with respiration or breathing could be a presentation because of the inflammation that the heartworms can create in the lung tissue itself. But it can also just present as vomiting. It can present as lack of appetite. It can present as weight loss. And eventually we do start looking at it. And even now in the combo tests that we get, to test for feline leukemia and feline AIDS, like we talked about in a previous issue, issue of this, they now can test for heartworm as well.
Interesting. That's
so we can at least screen them.
Yeah. Probably earlier than you normally would without that test, right?
Right. And it's tough because it's not something, again, that is always at the forefront of our brains. And unfortunately, they can have a lot of different symptoms that would mimic heart disease, because the worms, when you think about a dog that has heartworm, they can have a massive worm burden. So they can have 30, 50 adult worms. Think about that size of the heart in some of our dogs and the massive lung tissue. In cats, it's usually 1 to 3 adult worms, if they progress to that phase. But think about the length and how small their heart and the lung tissue is. And it really kind of wreaks havoc because it disrupts the blood flow. It disrupts lung capacity, because then you get this inflammation, which creates these secondary symptoms. And sometimes, we probably miss a lot because it can create, just like we talked about thromboembolisms in a previous episode during the heart discussion. They can just suddenly collapse and die. And, my first thought's always, oh, it must have been hypertrophic cardiomyopathy, but it could have been a heartworm disease as well. The reason I'm not as, concerned with maybe missing that, it's just because it's rare, to see it.
Yeah. Does it show up on x-rays?
Sometimes you can see changes consistent with heartworm in the x-rays. Typically in our dogs, we tend to run an antigen test. It's looking for the antigen, specific to the heartworm, adult heartworm. But in cats, because their worm burden is so low, that isn't necessarily as sensitive to be able to pick up every case. So we oftentimes also look at, what they call an antibody test. So what we're looking for is, have they been exposed to heartworm?
Yeah.
Because then that leads us to continue the process. Take the x-rays. Do we see changes that could be consistent with heartworm? Do we do blood work and see certain changes, a high eosinophil count, which, we often attribute to parasites, whether it's GI or heartworm. And then ultimately we can see them on ultrasound. So sometimes that's even performed as a means of diagnosis. You might be looking, maybe the heart, there's a valve issue, there's a thickening of the heart, there's something going on in the lungs, a mass, and all of a sudden, lo and behold, you see these strings that you go, oh my goodness, it's heartworm.
Wow, that's interesting. Now the tests, are they inexpensive? How expensive is it for someone to have their cat tested?
Most of them are reasonably priced.
Okay.
Like I said, in our practice, we had a combo test that was leukemia, AIDS, and the heartworm, test in our practice. So invariably, we weren't going, hey, I want to test for heartworm. We're going, let's check their leukemia AIDS status, and whoa, hey, we got a positive, and then it's kind of, is that a true positive or not?
Right. It sounds like, especially if your cat goes outside at all and you're in southern states, sounds like that test would be something you'd want to just ask for in your annual exam making sure for peace of mind.
Absolutely. And if you go to the American Heartworm Society, we should be testing all dogs and all cats for heartworm on an annual basis and putting them on preventives year round. Because heartworm's out there, and we know cats aren't immune from getting it. But it's that balance of trying to figure out, the lifestyles, all these other things, locations, because it's rare. There's not many that are just routinely going, let's screen every single year.
Right.
For heartworm in our cat population, because once again, that's not in the forefront of what we would anticipate seeing. Though stronger arguments definitely could be made for the South, just because of that higher, the higher risk that's involved because of the prevalence of heartworm in those regions. But it's been diagnosed in all 50 states. So it's not like any one state is immune. Just like one of the, the interesting things, and you kind of mentioned it, is, if they're outdoors, we should be thinking about testing them, and absolutely correct. But we hear our dog clients that will say, oh, my dog strictly indoors, goes on pee pads in the house, so I don't have to worry about heartworm. And we all know the mosquitoes are buzzing us at night in our house too. So, it's indoor or outdoor you have to be concerned with, particularly in areas where there's a high occurrence. And we saw, particularly in the Northeast after Hurricane Katrina, we had to revamp our entire protocols, because as the pets came from the South, it takes 6 to 7 months for us to identify an infection in our cats and dogs. And so even if they come with a negative status initially before they came up, you really can't completely say they're negative until you retest them about 6 months later. And if you still get negative, it's great. But we've started them on, we've started patients on heartworm, and then all of a sudden next year they're positive. And so we go, oh my goodness, they probably came from the South with it. We just waited a year to retest. It's not like it was a failure of the medication.
Yeah.
Is it for cats too?
And speaking of medications, so let's say someone gets a diagnosis of heartworms in their cat. Is there medication for that? Is it treatable to get rid of them?
Unfortunately, in cats, it's not. the treatment that we use in our canine patients to treat is arsenic. Really, it's a a dose that obviously does not harm our canines. But in cats, we can't use that, and there's no known treatment. So we're really kind of treating systemically and hoping that they clear. We know that infections, barring any complications from those infections, can clear in 5 to 7 months in our dogs, and sometimes a little faster in our felines, just because of that not being the natural host. They can die a little sooner, but there's that time frame where you just try to control symptoms and control inflammation and hope that it doesn't create a clog or something that would cause sudden death.
Yeah. Wow. So, but they could die off in 5 to 7 months. So but then do they leave permanent damage behind?
Absolutely. And that's the big concern in our cats is, even if they clear it, the damage can be long lasting.
Yeah.
The changes in the lungs, things like that. And again, it's not 5 to 7 months. In dogs, it's 5 to 7 years before they will die off.
Oh, wow. So that's really serious. And then if you test every year, like let's say your cat tests positive for heartworms and has heartworms, there's nothing you can do about it, but you're testing every year. At some point, will they test negative, or is the test for exposure? And so they're always going to test positive.
Depends on which test you're looking at. If you're looking at the antigen test, we would tend to see that clear as the adult is no longer present.
Okay.
With antibodies, those can linger for a while because the body mounted this this response to that exposure, just like when we're testing other disease processes like Lyme and things like that. I mean, you can treat it, but the test could still be positive, but you have to go a step further to titers and things like that to determine success or failure. And and in this case, we're just going to kind of monitor and watch for symptoms, knowing we're not treating, get beyond the life expectancy of the adult in the cat, and know that clears, but then have to monitor very closely for those the processes that can occur with respiratory diseases and heart changes due to damage from the heartworm itself, watching kidney function and liver, all these things you have to now kind of monitor to make sure that the heartworm didn't create any long lasting severe changes that that could impact the life expectancy of our cat.
Yeah, that's sounding like it's the most serious parasite a cat could get.
Yeah, because the concern becomes that we know it can kill both dogs and cats.
Yeah.
It's we always say prevention in the case of heartworm becomes the most important, because we know even though in the dogs we have treatment, there's still a concern. Does that treatment end up creating a situation where, as those adults die off, it creates an issue where they throw a thromboembolism and they die suddenly? Like there's a lot that even goes into the treatment course of dogs, because it's not just well, here's the drug, you're done. There's ramp up where we're using doxycycline as not only an anti-inflammatory, but it has an impact on weakening the heartworm. And then you get them started on the prevention, and then you finally treat in month 1, and then you treat a month later with 2 injections, and then they have to be kept at strict rest for 6 months. I mean, this isn't a benign treatment course. Now we don't have that in our cats, but now we have to really watch them and keep them quiet even longer because we don't even have the ability to control it other than steroid to help with inflammation. And
Yeah.
so that's why it is serious. The good news is we don't see it as often in cats. And that's why you don't hear veterinarians oftentimes going, let's test every year. Absolutely, 100%. Every cat needs to be on heartworm prevention 12 months out of the year. We have them. The same that we use in
But
dogs.
we do hear that. I mean, I had an email here from one of our listeners that said that spurred this, that said, how much of an issue is it really for my indoor cats? I sometimes think the vets advocating prevention just want to do a little extra billing. I've never heard of a cat belonging to anyone I know having heartworms. So, I mean, it is rare, but it's also potentially deadly and not treatable. So why wouldn't you, why wouldn't you at least do some level of prevention? What is the medication like? And are there any risks of the prevention medication?
They're oral. There's very minimal risk with these. Like any medication, there's always going to be that pet that has a reaction to what's being used. But there are topical medications as well as oral medications that are out on the market for the prevention of heartworm. And I'm absolutely with you, Molly. When we think about, yes, it's rare, but if they get it, you can't treat it. And if they do get it, it potentially could cause death or lifelong medical issues moving forward. That is why the American Heartworm Society, says, think of the number 12, test every 12 months because you just want to monitor that you're not seeing anything. And then 12 months of preventive, because we know that the preventives for the most part are very effective. We just, but one of the reasons we always recommend it in our dogs on an annual basis is there's two things. One is, just because you sell 12 months, does the pet get it for 12 months? So I always used to say, because I'm always transparent, it's my client check. Have you given it? Because if you bought it and you gave it, there's shouldn't be any reason they should become positive. And then so we're doing it that way. And the other thing is we're also always monitoring, because the nature of organisms and parasites are they get smart and they start to develop resistance. And we have to monitor if we start to see an uptick and we say, wow, we know these patients are on heartworm prevention, yet they're positive. Now you start looking at the drug itself. And so there's and there's probably other things, other reasons I could talk about, always want to do that. And cats would be no different. But to your point, one, cats don't come in as often, as our dogs. And right. I think the email you received is also that. It's like, well, if it's rare, do I really have to?
Right. But I think you look at it like insurance, right? It's buying insurance. You want to buy the right amount. You don't want to buy too much, and you certainly don't want to have too little. And I mean, if you live in an area where there's lots of mosquitoes, I think you've got to do it. Now, one of the things that I often do, there's a product out there called Cedar Side. And it comes in a cedar oil flavor, which I found cats don't like a whole lot, but it also comes in lemongrass scent, which cats do seem to tolerate better. I spray it really heavily on my hands and then just rub through my cat's fur, like onto the skin, because it's a mosquito repellent, natural. Right. Mosquito repellent. So, but I live in a pretty dry climate, high elevation. Unless we're having horrible monsoons, we don't ever see mosquitoes here. So, right. But when we're in Texas, we do, of course. So,
right. Yeah. And, and again, there are, that's another form of trying to prevent the spread of disease is maintaining some form of mosquito control.
Mm-hmm.
And there are a lot of services out there. I mean, I use one at my house that comes and sprays every like 3 weeks during the mosquito season. Primarily, we're doing it so we can enjoy our backyard without having to worry about getting eaten alive.
Right.
But indirectly, it's also helping our dog. But ultimately, the only thing that we know that's proven to truly prevent the disease are the, preventives that are FDA approved, because those are the things that we know take care of and prevent the spread of heartworm.
Right. Because all the other diatomaceous earth and the cedar side products and things like that, if you're not doing it all the time, right, because it doesn't last a month, obviously it lasts for a few hours, maybe an afternoon, maybe a day at best, that the cat smells like that, has it on it, that's actually repelling those parasites. So I definitely agree the best treatment would be the oral treatment or topical, because they have a topical that's a tick, flea, and heartworm combo for cats, right?
They're starting, yeah. I mean, more and more coming out. We had, through one company, came out with the very first all-in-one that does fleas, ticks, heartworm, parasites, GI parasites as well. And now a second one is getting ready to be released, on the market. So they're constantly improving. And the way I kind of think of it, particularly the all-in-ones, in our dogs, I can say, okay, we definitely need flea, we definitely need tick, we definitely need heartworm, and yep, we want the GI parasites as well, because we know there's a high prevalence of those.
Yeah.
In cats, the talk would be, we definitely want the flea, we definitely want the tick, we definitely want to control the parasitic GI parasites.
Mm-hmm.
And the benefit of them now is we also cover heartworm, which, while rare, it's already in the product, so no harm, no foul.
Yeah. No, that'd be great. That'd be awesome. Yeah.
And so it's just a little different approach, because we're all creatures of habit, and we've treated heartworm in dogs for years. When I first started, it was a daily pill that you had to give your dog.
Wow.
And now they're oral every month. There's even a 6-month injection, and there's a 12-month injection in our dogs. So the more we talk about heartworm in cats, if we started to see an increase in the diagnosis of heartworm in cats, I think it becomes easier for us to change the behavior, to get owners thinking, hey, let's prevent this because it's easily preventable and there's no treatment. And it's just going to be a process over time, and with that, maybe one day they'll come up with a treatment in cat.
That's true.
We just don't have one right now.
Yeah. I just think it's, I also wonder, maybe it's not as rare as we all think it is, because they go undiagnosed. There's a lot of people that aren't going to spend the money for, tests, and sometimes vets know that and won't even suggest it. And it just goes undiagnosed, and cats die suddenly, or they're having trouble breathing, and you're assuming it's a heart issue or a asthma issue or that sort of thing. I remember I had Tabasco was my cat, and he had an x-ray which showed lung damage. It showed pretty, she never mentioned that it could have been heartworms. We lived in Texas, so it probably could have been, but she never mentioned that. But there was a definite change in his lungs. There was lung damage, and we couldn't really pinpoint anything that it could have been, other than maybe dust from clay litters or scents around the house or things like that. But that very well could have been heartworms.
Absolutely. And that's, and that's part of the issue, is because it's not common to routinely test for it. And even leukemia AIDS, the recommendation isn't that every single year you're testing cats. We can say in the literature, there's arguments that we should be monitoring leukemia AIDS every single year in cats, but we tend to test them and then either vaccinate for them or only test when there's symptoms. This is no different. We only think heartworm when everything else is coming back negative, and we're like, okay, well, let's now look at the heartworm component. And the test, again, it's tough to diagnose, but boy, when you do get that positive diagnosis, it becomes really important. It's no different than think Lyme disease in the past. We probably had more Lyme disease in areas faster than we knew, because it took a long time before we routinely test for it. I almost tell my canine patients, I'm more worried about Lyme, and that test is, so the heartworm is combined with anaplasmosis, ehrlichiosis, and Lyme disease. So I want to monitor that far greater than the heartworm, because most of my canine patients are on heartworm, but it took a long time to get there.
Yeah.
And so probably by the time my daughter's well into the middle of her career as a veterinarian, this could be a different conversation that she could have with you, because she'd be talking about, oh man, we routinely diagnose heartworm in cats now. But
and hopefully there'll be a treatment by then too.
Right. And and I think, again, right now the thought process is they aren't the natural host. It's rare that it that they get it to where it becomes clinical. Therefore,
there's no incentive to make medications to treat it. No one would buy it, right?
Right. Well, the medications are made, but to your point, and to the one that sent the email to you, sometimes it's like, hey, heartworm. Well, but it's kind of rare. I know that because I read about it, or I listened to this show and they said it's rare. So why the heck, you're just trying to pad your bill and make more money by selling me a preventive that's really not doing anything. But now today, I think we've educated everybody to say it's not about padding the bill. We're talking about an easy prevention in a disease that's not treatable, that can potentially kill our patients, because this parasite is that devastating if they get it. And even if they get it and recover from it, there can be long-term implications that they have to then deal with the remainder of their life. And so, boy, an ounce of prevention.
Exactly. Literally, right?
Exactly.
Yeah. No, I think that's it. And I think that's really the takeaway, is that, there's going to be a lot of listeners who didn't know their cat could get heartworms. There was any such thing as heartworms in cats, because they don't hear about it. And then B, the understanding that there's no treatment, because we see heartworm treatment for dogs all the time. So, you think, well, then there's got to be a treatment for a cat, no big deal, but there's not. And then the seriousness of it. And so, heck yeah, do some form of prevention if you're in an area where there's mosquitoes. So you see mosquitoes around, they're landing on your pets just as much as they're landing on us. Right. So absolutely. All of that is prudent and makes total sense. So I appreciate you educating us on heartworms in cats today.
No, it's always my pleasure.
Yeah, absolutely. All right. And thank you, everybody, for tuning in. Get your cat some heartworm prevention treatment the next time you take him to the vet. And if you haven't taken your cat to the vet in a very long time, make sure you get him in at least annually. Maybe twice a year if you have a senior pet or a pet with other issues. So I know it's stressful and it's hard to get them there, and it's a real pain in the butt, and it stresses everybody out, but it's absolutely necessary. You need to do it. So get your cat to the vet and get some heartworm prevention treatment. Summer's not over yet. So
Couldn't have said it better myself.
All right. Thanks for tuning in. And until next time, keep calm and purr on.